Hello, welcome to Care Management Webinar number 2. Today we're going to be talking about getting to know your client. My name is Belle, and last time we talked about the collaborative care model. We reviewed forms titled Script for the Initial Telephone Call, Contact Information, and Initial Visit. We talked about those telephone call notes and the PHQ-9. Today we're going to be talking about Getting to Know You worksheet and the Vital Sign worksheet. So I'm curious to know if you've used any of your materials from last week. I hope so. I hope they've helped you just to be organized and to make your job easier. We're not trying to be a burden, but we're trying to help you do your job, and you might have a system already, maybe you have your own style, maybe you can just incorporate one thing or another to make you more effective. I hope so. Okay, so just as a review, the collaborative care model is a systems-based approach. So we're managing depression in this situation. It could be other conditions, but we're supporting the client by having multiple providers draw attention to an immediate problem that could be solved, and also to strengthen the recovery environment. So our clients have fewer and fewer immediate problems and they become stronger. Okay, the activities of this model are, because we have more people on the team, we need to communicate with each other. We need to educate the patient and their families, and we want to support the patient so that they're more involved in their care, not only more involved in their condition, but their wellness. So the characteristics of the care manager. You might be someone who works within an agency that provides care. You might not. You might work for a church and you're associated with an agency that provides care for your parishioners. You might be a social worker, but I can tell you the glue that holds things together. You're the person that client sees all the time. You're the person that they have rapport with. You're the person that tells them how their week's going. You're the person that they're at ease with. You're learning so much information that it would be so helpful for the provider to know. So the goal of the care manager is focused around helping that client engage in services, know what their options are, help them to decide what option they want to take, and then keep track of it. Is it working? Is it not working? Kind of working? Trying something else? You're a key person to help this process go. So today we're going to be talking about the Getting to Know You worksheet. Now you called them, you had your initial visit. You're going to spend some time with them most likely before they see their provider. And so the Getting to Know You worksheet is simply that. We're getting to know you. If we don't know you, it's harder to help you. Okay, so the Getting to Know You worksheet is helpful because it identifies things that the client might do to help themselves in the future. It helps us to understand their experiences with previous treatment or experiences that their friends have had with treatment. It helps us to understand what the obstacles might be. It helps us to understand if there are other issues that could affect the plan, like say alcohol issues. It helps us to know if something really serious has happened to them in the last 12 months that might be a reason why this episode is significant. And it also helps us to capture some questions that they would have for their provider. I'm going to take you to the Vital Sign worksheet now. I'm going to take you to the Getting to Know You worksheet. And this is a worksheet that might take a while to get through. You might not get through it in your first visit. And what you want to tell the client ahead of time is it's simply that. We're trying to get to know you. If we can get to know you, we can help you better. So you can either answer this sheet in your own privacy, or if you would like, I'd like to go through it with you too. Again, it's something that might bring up some memories, might bring up some stories. I don't want to forget about the stories. I'm going to make sure we come back to them later. So for now, let's just try and stick with the questions, and then we're going to make sure we keep track of everything, okay? Okay. So you start out with understanding what language that they prefer. Is it English, Spanish? Is it something else? Do you need a translator? Whatever. You want to make sure that this is easy. And then activities that I can do to help myself seems kind of out of place here, but it's not. You are a ray of hope for them, and they And when you ask them this question, if you could imagine having depression and being in a tunnel for a long time maybe, what do I like to do for fun? Like, I haven't even thought of that. I can't even remember. So don't be disappointed or don't be surprised if they can't think of something. But this is the beginning of the hope for them. So it's okay if you can't think of anything now. Maybe between now and the next time we meet, you might remember something they used to do. So it sort of starts the ball rolling. And as you get to know them, they're going to maybe tell you stories and you go, oh, so you do like music. Okay. So let's keep track of that. And you can put this on this sheet and refer to it later. Likes music, used to take walks, likes to go to the coffee shop, whatever, things that are fun to do. This is a nice place to put it. Okay, so my experience with treatment, we want to check everything that applies. This is a time to just, anything's possible. It might be that maybe your client has been diagnosed with depression in the past and maybe didn't have a good experience, didn't have a good therapist, or had a bad experience with medication, or maybe their mother had a bad experience with medication. Those are all really important stories. And so this is a place to capture that. Maybe they think it's wrong to take the medications. And this is not the time to debate it. We don't expect you to fix it. It's just a place and a time to keep track of it. If there's anything on this list that you can't find, you can check other and write it in yourself. Okay, things that would make it hard for me to get care. So say they really do want to get care. They don't have really any objections for receiving treatment, but they have a lot of obstacles. So what are they? Is it financial? Does it have to do with insurance? Does it have to do with transportation? I'd love to see a therapist or go to a doctor, but I can't get there. I can't get anyone to watch my children while I go. Or just making a phone call could be huge. How many times have you called someplace and it's like, click 1, press 2, and then you get into a whole different menu. Imagine if you had depression and this was overwhelming to you. Just reaching out for help. Knowing that will help you help them, so that they can get the help that they need. Some of these simple things are huge to someone who's suffering from depression. Sometimes it's huge just for everybody, right? Embarrassment. Maybe they've been feeling this way and nobody knows about it. Maybe you're the first person that they've actually had a conversation about it. This is a great opportunity for you to sort of normalize this and let them know that other people have that they're not alone. Maybe nobody in their world knows, but maybe there's a whole lot of people in the world that they don't know either. And so reaching out for help is really kind of a normal thing now. And so you've noted that they're embarrassed, that you might be the only person that knows, but that you're a ray of hope. And this is okay. All right. Communication. They might feel that they can't adequately communicate in their provider's office. So again, a translator or facilitating that is very helpful. They may feel like letting this information out could somehow, they might be discriminated against. It might affect their job, might affect their status in their family. This is very, very important for you to capture. And it's important for you to let them know that this is information you are going to share with their provider. It's not something that you're going to be passing around. It's very confidential, and that you will treat it as confidential, but that you will be sharing it with their provider. You don't want them to be in a situation where if you didn't tell them that and another provider mentions what you've collected on this sheet and you didn't share with them, now you've broken trust. And so they're never going to tell you anything again. So just make sure that you treat all this information with the utmost in confidence. Okay, then next we're going to ask them if there's any other issues that might influence care, such as substance, alcohol. And so the best way to get at this is to ask, just as it is, in the last month, quantify how many drinks you've had. Have you had 5 or more drinks of beer or wine or liquor in the last month? Yes or no? Did you ever think that you were an excessive drinker? Did you think that? Maybe you were. Yes or no? Have you ever drunk as much as a fifth of liquor in one day? Yes or no? These are all indicators that alcohol might be an issue. You're not making any judgment. You don't want them to feel bad about it. It's just to quantify their use. And then medications is next. If they have their medications with them, it's a great opportunity to write down the name and also the dose and the frequency. So many times you hear, it's the blue pill, it's the pink pill, doesn't really tell us anything. But if you could see the bottle and write it down exactly, that would be really the best. And then lastly, events that may have happened in the last year that could be contributing to this episode of depression. Has somebody died that's close to you? Have you had an argument at home? Are you going through a divorce? Is somebody in your family going through a divorce? Anything that's serious in the last year that's important, and it could be playing a role. So again, if there's anything that's not on our list here, you can check other event and add it. It could be finances, it could be illness, maybe it's change in home. Sometimes even good things can also be significant and cause stress. And then lastly, the questions for provider. I don't know if you've experienced this, but sometimes I've gone to the doctor and I have questions in my mind. I can think of all these questions before I go. And then I get there and I'm a little bit, starstruck or something. I forget everything. And as soon as I leave, I think, I didn't think to ask this and that. So this is a good time when you're meeting, before they meet with a provider, to say, what kind of things are you worried about? Is there anything that we haven't talked about today in going through this getting to know you worksheet that you want to share with me? And so you could write them down, and then even if they do forget, you've shared this with their provider, so their provider already knows what those questions are. So this is a long sheet, and there's a lot of things to cover. It may take a while to do it, and that's okay. Maybe you only get half of it done, but it's something that you can work on as you go, as you get to know each other. And you want to make sure that you thank the client for trusting you with this information, and just reinforce that you really do care and that you want to get to know them so that you can